It is, Vinny.
I can't figure out a way to get rid of my profile picture, so I guess we're just going to do it.
Fine. You playing Tom Brady there? I don't know what that is. Okay.
Tom Brady is a Tampa Bay Buccaneer.
Oh, okay. Got it. I thought that hat looked funny. Okay, let's see. Being 7 o'clock, let's open the meeting for the Bellingham Board of Health for April 28, 2020. Myself in 40 chair, Vice Chair Trish LeClaire, Member Kelly McGovern, Minutes Clerk Tina Griffin, Administrative Agent Laura Renaud, and Health Agent Bruce Wilson. Did I miss somebody? I don't think so. Okay. So first order of business is the minutes from April 21st. So.
Okay, I'd like to make a motion to approve the minutes from April 21st as submitted.
All right, I second that.
Okay, all those in favor say aye. Aye,
Aye.
opposed, abstained, so carried. Okay, 7:15, whatever, 7:02. Coronavirus updates.
I enclosed in your packet there, the board that wanted to see how the towns applied the grant money. So I
Okay.
was able to get a copy from Mary. From Mary where things are. So that's the list of where they are and what's left. And then I got a call from the Charles today. They've got a couple of positive cases over there. And Amy, the director over there, had some questions as to work orders to go into the apartments to maybe change a light bulb or work on the washing machine. What's the board's feeling? How
It should be for, like, someone can go in there if it's an emergency situation only.
Right. And then they should be dressed, to the hilt with the PPE. But I mean, she's kind of concerned as that, if somebody calls and said there's a light bulb out or something, I mean, is she supposed to respond to that, or can she leave, say, like a light bulb outside the door and let the people, put their own light bulb in, or she was.
I mean, if they feel comfortable with replacing the light bulb themselves, but let's say it's a ceiling fan that has 3 light bulbs in it, right, and one's out, like, no one needs to go for that.
Right.
Common sense kind of.
If there's a leak, yes.
Right.
Yeah, like if there's a leak, that's an emergency type of thing that they would want to. Oh, it's going to cause property damage.
The only thing in the light bulb, if you have a hallway light, something that's going to, sort of affect your egress or ingress to different rooms, you don't want to be tripping over things. So I would say, yeah, you'd leave the light bulb there unless it's a fixture that is enclosed. Then you probably want to have someone who knows what they're doing that, because you don't want the glass thing to fall on them. The other thing too is, if they don't have a ladder, they won't be able to change some light bulbs. So I don't know. I think they have to dress out, and if they send maintenance in dressed out, I think that's adequate. Now, we had several weeks ago one case. Now is that case been resolved? It was several weeks ago we had one at the Charles, but
yeah,
these are new ones now.
It's one case, and one being actually it's under quarantine from contact.
Okay. But separate from the original case we had?
No, same case.
Same case. Oh, okay. So
that case was a while ago.
yeah, at least 2 weeks ago.
Yeah, I know. I'm surprised that hasn't gone back into circulation at this point.
Can we get an update on that from Esther?
You know, it's not on me even either. So I'm wondering if it was, she was told she had corona from her doctor, but it never got entered in. That I went to look for it today, and it's not on the list.
So maybe she wasn't tested. She might have been one of the people that just had symptoms.
Right, that's what I'm wondering.
Yeah.
We should still be able to follow up with that person though.
Yeah, I'm gonna see if we can't get a phone number and reach out to Esther, or have one of us call and find out what's going on, and whether or not it's been long enough. You'd think that they'd be able to start to go back in the population.
I mean, if you can go back to work, if you have no fever and you're symptom free after 7 days, I think they should be able to go in there.
Yeah.
It's been 2 weeks at least.
Yeah. And it looks like the only 2 places that have 2 separate residents, it's probably unlikely a light bulb will go out in that one. I mean, they got a lot of apartments there, and I'd still say if they're going into an apartment, they can't keep 6 feet. They got to at least have a mask,
Well, for sure.
For sure. Right.
I mean, if the tenants are putting their trash out in the hallway instead of out in the dumpster, I mean, they're causing all kinds of grief for her maintenance people.
I don't understand that.
Taking sheltering to a new different avenue. I don't want to go to the dumpster now. Right. I don't know. Some people will do that, I guess
they're rarely sheltering in place.
Yeah. So let me add something. I guess everybody is aware that the governor now extended the advisory.
Vinny, before you do that, can I ask a quick question regarding the grant money? There are a few laptops on here. What were those for? I know we approved the one for Bruce, but there's 2 other laptops, a webcam.
Oh.
What's all that from or for? Do we know? And Esther's stuff isn't on there. I know Dennis had mentioned before it was going to come from somewhere else, so I didn't know if that already happened or not. But there's all kinds of stuff on here that.
Oh.
Yeah, that is true. I remember them saying that her money that she was being paid was coming out of that.
Yeah, and it's going to all kinds of different IT stuff.
Really?
Laptop, webcam, laptop, iPad I know is for Bruce. And then there's another laptop for Zoom. There's 4 laptops here.
Wow. Okay.
Kelly, this is Dennis. We can get you a summary on that. What those purchases were for. I don't know off the top of my head, but we can get that for you. And I know we did say that salary would be covered through transfer, and I've spoken with Mary today, and she is looking at where that's going to be coming from. So not to worry. I know we'll be running a significant deficit in that account. I think we appropriated about $10,000 a year for Esther, and obviously she's probably running that a month right now. But we will be transfer funds for that, so I don't want your board to be thinking you're going to need to find that. We'll certainly make those transfers. During May and June, the selectmen can do interdepartmental transfers, so they can transfer funds from accounts that are running over to accounts that are running under. So,
Right. Well, there's another $10,000 according to this breakdown from that grant, so that should be able to go to Esther, I would imagine, but unless it's allotted for something else we just don't know about. I don't know.
Yeah. Okay. Thanks, Dennis, for that update. And thanks, Kelly, for catching that. We'll get a breakdown of that. Okay. So like I said, I guess we're going to be holding the line till May 18th. And then the other thing he mentioned is, had it happen on May 4th, it's not going to be a blanket, everybody opens. They're meeting now with Lieutenant Governor Polito. She's going to meet with a group, and they're going to have like what they call phased in effects. So the non-essential businesses that are somewhat sheltered out now will be phased in. And they didn't say which ones and what types, but they did say, I'm assuming they're talking restaurants maybe as a first phase and stuff like that. I don't know. So we'll have to see where that goes. We should get some input later in the week, next week. So, okay. So anyway, anything else from anybody on coronavirus updates?
Yeah, have you noticed how many other towns have taken our lead on the mask requirement?
Yes, yeah.
There were 4 more. from what I-
Cohasset, Cambridge, Somerville, Lawrence, Winthrop, they're all
Yep.
following suit,
Yep.
so I guess we
Yep.
weren't so bad.
Uxbridge.
I did go into Stop and Shop today, just for a quick moment, and there was at least 3 people that I saw not wearing a mask.
It's going to take a little while for the Rhode Island people. Every time I had gone in there, and if I did see one, I approached them. I took a Ziploc bag the other day and put a dozen masks in it and walked around. If I saw them, I approached them, and most of them were. I asked them, are you a Bellingham resident? Were you where? And they said, oh, no, socket. So I think the word will get around. All of Rhode Island has the mask as well, so it's just a matter of them, getting used to it. When you go over the state line, you got to bring.
Bruce, did you ask the manager to keep an eye on that? Because they had mentioned before that they may not want to comply with our order.
I had talked to Kim. Now that statement that was in the Milford Daily News was a blanket to cover all of their stores, and the manager over there, Kim Lyons, I think you remember Kim, or she had come or talked at one of our meetings, is aware of that and is pretty good about it. Unfortunately, there's nobody standing on the door to catch them as they come in. It's only once they're on the floor. Some of the managers are also, have masks, and if they see them, they ask them to put it on. So it's hopefully by the end of the week or so, caught on, and we see less of it. Nope.
I guess there were gloves all over the parking lot today too, all
Yep.
over.
Because yesterday wasn't bad at all when I was over there.
Okay, well, we're gonna have to get down there, get a picture of it, and
Let's see. I mean, the cleaning crews have been doing a pretty good job. I'll take a right by in the morning.
Okay. Okay, so, anything else? Anybody?
On Corona, no.
Okay. Okay, next item is Earth Day cleanup updates.
We had a whole bunch that I hand delivered our wonderful, beautiful, fashionable T-shirts over the weekend to a bunch of families. I got the rest of the T-shirts delivered to me so that I could just get some out of the house, so I can go hand deliver them and throw them on their porches and stuff.
If
Yeah,
everybody,
good.
if everybody checked their email, I believe I emailed over a certificate that Laura had put together today. If not, I'll check. Maybe I forgot to hit the send button. But Laura had put certificates together for both of the students that had the one for the design and one for the logo on the back that we've got prepared. And then just if we could get one of you to print it and then sign it off. I'm going to take a
I didn't see it. I did deliver the T-shirt to the winner of the design, and she goes, "Where's my gift card?" I'm like,
Yeah, I know. I'm going to
"Hopefully don't forget that."
I'm going to do a site visit over at Home Depot tomorrow and see if I can pick up a couple of gift cards, and then I'll get them over to you.
Yeah. Well, they did see our announcement, right? So I guess they didn't forget. Yeah, I really like the postings we had on our website of people
I'll
picking
keep
it up.
doing it.
They
On
did a great
the
job.
nicer days, I'll keep posting something and try to get people to at least contribute somewhat. We're going to be left with a lot of T-shirts otherwise, so I just want to get them out there.
I wish we had a small one we could put on the Beagle. That was pretty cool.
Yeah. Exercise good for you, by the way, so you don't gain the COVA waistline increase, whatever. Okay, so let's see. I guess Bruce, health agent updates, complaints.
Mostly people complaining about people not wearing the protective gear. I get a complaint, I go out and I look and try to get people to wear it as I see it. Haven't got the chicken complaint lately, so I'm hoping that resides a little bit so that we have a better day before we go out and catch the birds. The guy still hasn't picked up the certified mail yet, so I think we may have to send it by sheriff.
Yeah, constable, yeah. Okay, I guess he'll have less time once he gets it. No, he still get the same number of days, but okay. Yeah, that day you went out, Bruce, for I think you said you handed out 4 masks. I went out in the afternoon and I gave 1 mask to one person. It was, the guy did stop him. He was trying to go into Walmart, so I gave him a mask. He also was from Rhode Island. It's kind of ironic, you know, but whatever. But anyway, we'll do that as, you know, and give them a warning saying, hey, you can't come in if you don't have a mask. You're not going to be allowed in. So I guess also we had an incident at Staples a day ago. So
Yeah, the gentleman pushed his way through, and the Staples manager had called me and reached out to the police department. I believe Trish talked to her as well.
Yeah.
But I mean, you know, I told him, you know, avoid the confrontation. It's not worth the effort if they're gonna barge their way through there.
Right.
It's not much we're gonna do without causing a big scene and incidents that, you know, that hopefully those become fewer and less. I think Dennis and I are gonna try to meet with Jerry and come up with a something if the stores call and make it more urgent that, you know, maybe the police might respond there and deal with the people that are failing to, you know, listen to the stores when they don't want to allow them in.
So one other thing I can add, on Saturday, Bruce and I responded to sort of mutual aid with the fire department to a oil tank that ruptured, and it happened to be full. So let's say 270 gallons, went completely out into the storm drain and into the Charles River. So 4 hours later, we got the people to either stay with their daughter and son-in-law. I don't know. Have you heard back if they're back in yet?
No.
Fine.
They're still cleaning. They went to clean the catch basin, and the catch basin disintegrated, so they turned into a bigger out there.
Yeah, it looked a little old. Yeah.
I don't know where and what to do or how to begin on this. On these older houses, I would like to think that the company that's servicing the oil burner each year should take a look at the tank and recommend to people when it's time to replace out that tank, because that was not good. 200 plus gallons went into the Charles River that won't be able to be serviced or cleaned up.
Right. And that tank was, they said when they bought the house, it was 50 years ago. It was there. So it's 50 plus years. That brings a point that I brought up several years ago. We probably, you know, maybe, you know, as a groundwater protection advisory, you know, the Board of Health suggests that you check with your oil burner or check your oil tank and see. I think they're tagged with the mass tag, the date they were installed. So I'm certainly the fire department have a record, but we're not going to go that route. I think each person should at least have someone check it, you know, because these get to be real costly when they break the confines of your home. And if they don't break the confines and get into your basement, everything you got down there, and it was quite a bit of stuff.
Yeah,
Sort of hoarded. Yeah, covered with oil.
Quite call it hoarding, but pretty darn close.
Yeah, it was close. Yeah.
We should put this back on our goal list where we're supposed to come up with some sort of goal to assist people with older tanks.
Yep.
I went on one, what was it, 2-3 years ago down in the Acres, and it was a whole tank that went under. So we were supposed to kind of maybe get together with Midway Oil or something and do some sort of program with them to get these oil, especially the exterior that aren't double walled, replaced. And because there's a lot of them out there.
Yeah, I see it in quite a few houses in Bellingham, the older houses, the tanks outside, not even at least shed it in so the water doesn't hit it. But the rusting is normally occurring from the old tanks that have a port on the side instead of the bottom. So water accumulates because oil floats on water. Even in a 275-gallon tank, the water's in the very bottom. It rots the inside of the tank.
That's what happened. It rotted. The whole thing rusted out. And
it just popped right out.
Yep.
Remember, like,
150,000, I think it cost.
instead of water being 8 pounds per gallon, let's say the diesel's 10, that's 2,750 gallons of weight on the inside of the tank. It's 5 feet by 30 inches. That's quite a concentration of a little over 1.25 tons directly concentrated on a 5 by 2.5 foot area, 10 square feet. So that's kind of crazy. And we might, Kelly, be able to look and see if under the state's pollution abatement trust, for every oil product or automobile product that goes into like a radiator or an antifreeze, oil, transmission fluid, gear fluid, you pay a state tax on that. It's called hazmat tax, and it's worked into the cost of the oil. So that goes into a revolving fund. So maybe, you know, via the fire department and board of health, we can access those funds and then get, you know, somehow people to comment how old that tank is, you know, then verify it. And
Kind of like a betterment loan type thing, but with a
yeah,
grant. Yeah.
yep. If
I
you
think it's
look
a
at it
great
right
idea.
now,
Because most of these homeowners insurance companies don't cover the whole thing, and that's costly. I mean, the one on Maple Street is what, 200,000 plus is going to be
yep,
to do it all.
it's going to be around that.
So,
Yeah.
it's massive amount, and I mean, what's a tank? $1,000. So
Yeah, about that. Yeah,
definitely
about
worth it.
the double walls are about 13. The single walls are about 800 or 900. So yeah, 1,000's a good number. And like I said, we
The
could do that.
200,000
That would be great.
savings.
Protect groundwater at the best, you know, possible.
Well, we'll put that on the goal list after this Corona thing.
Okay.
All right, next.
So Bruce, any more complaints
I
and
have one-
stuff?
I have one more thing to talk about. DEP, the guy that was out to the site, Dennis, got a complaint Sunday from somebody over in Hartford Ave that a gray water discharge was coming from a particular house. So Laura and I have sent a certified letter telling them that they've got 15 days to apply for a permit to connect the gray water in. Otherwise, we were going to shut their water off or maybe issue a fine. So that, you know, that went out today.
Okay. Okay, food inspection reports. Robert, you got anything for us?
You're muted, Rob. Fix the mute. There you go.
Better? Okay. So I did do a handful of inspections the other day. I'm waiting on a couple of the reports to come back just because where I had to do them through DocuSign, they get sent to the person in charge to just e-sign, and then they're sent back to me. So I think there's 2 I'm waiting on. They'll be able to send over once those are done. And Bruce and I also had our conference call with Food Code Pro earlier. That seemed to go pretty well. They're calling me tomorrow just to fill out or to do their grant survey. And once we're approved, or if we're approved, I should say, they cover the cost of the software from now until July of next year. They give us an iPad and a bunch of other stuff. So the software looks pretty user-friendly and within the OS too. Basically, as soon as we go to do the inspection, it geotags where we are. So it shows the exact times that we were there in case there was ever a question in the future. It keeps everything in the online database so the board would have access to them as well as who's in the office and myself. And it goes in and just kind of shows you if there's a repeat critical, anything like that. All the food code is preloaded. So anytime that there is an issue, you just take a picture of it with the iPad, it attaches it to the complaint, and then goes the exact code and everything with it. So hopefully I'll have more.
That's awesome.
I know it's pretty good. Actually, Uxbridge uses it. So after the Zoom meeting, I reached out to Kristen Black over there to ask her how that was working out for them. And the picture part of it, she was saying, really opened up the eyes of the restaurants. If they've got a complaint, there's a picture of it, all of a sudden they're going to start to take better care of what's going on because they definitely don't want that kind of exposure. Uxbridge puts their reports on their website so that the general public could gain access to them if they wanted to, and can see, you know, which restaurants are actually providing the better reports, which is kind of something interesting. I don't know if we want to go that far or not, but the picture part of that really seemed to wake everybody up. You know, you catch the guy without the gloves, or you catch the guy washing vegetables in the hand sink instead of in the proper location. There's no question as to the violation, and it's hard to hide.
Yeah, plus it puts us electronically, it'll save space in the office files too, so, you know, and more repeatable access when you go from there from.
But I mean, they'll also save time, because once he's done with the report, he hits send. You know, it goes right everywhere we want to send it, email it, or whatever, right into the system. So you know, it's going to save time for Rob too, cut down on a lot of the effort that he's got to do, and then we have it quicker, and obviously we can address more complaints quicker. You know, it's all around a pretty good program. I was quite impressed.
So Rob, one quick question. So what percentage of the, let's say, total food establishments that happen are currently open for, let's say, takeout or delivery or whatever, or pickup, whatever?
That's the tough part, only because some of them are open. They're open on odd hours. I've just kind of been going around and seeing what ones are open and trying to pop by while I could. I knew that there was the ones over here on Mechanic Street, so I had done that plaza there, and then the rapid refill and just that section there. But again, it's tough because you don't know when they're open, what their hours are, or certain days too.
Okay, so they're staggering their hours, and they're not, you know, I guess, you know, consistently there 8 hours a day. Okay, great. Okay, next is discussion on public relations policy.
Yeah, I put that on there. This is just a suggestion, especially after the snafu from last week on the channel, what was it, 5 and the radio station.
Seven.
I didn't know if we should put something in place where if the press reaches out to us, we just do, you want to respond, or you want to comment, email it, and we'll email it back. I think going live was a mistake. And even video, I think if we have something in writing, they can't sway off of that. It was just a suggestion.
Yeah.
Then we have proof what we said. It was in writing, and it's our statement, and they can't mix our words up, which is exactly what they did.
Right. And we don't want a draft going out. We want the actual document
We
that
never
every
put a
member's
draft
seen.
anything on the website again. We can't do that. I don't know how the draft got up there, but like the pumping gas thing, that was the Milford thing, not ours, and that went that went nuts, and it wasn't even our final version. So we can't do that anymore.
So basically, probably
we should be reaching out to the press. I don't think we should be reaching out. If they reach out to us, I think we should tell them any comments to email us, and we'll get back to them.
Right.
It's just my suggestion.
I agree. What do you think, Trish?
Yeah, I think that's a great idea.
Yeah. Okay. This way here, we won't get ripped from everybody on social media about the press release or whatever it was, the thing that happened on that Thursday morning, I guess, whatever, a week ago. So anyway, okay.
So you want me to draft something up? And then
why don't you, Kel? That'd be a great idea.
Right. And then we'll just make it part of our department policy on media, whether it's this or something else. I think it's just the best way.
Right. I mean, should we ever get in November to a true EDS, for a vaccine for COVID, under the current EDS plan, Dennis is our PIO, Public Information Officer, and, he'll get with Bruce or whoever else to, get out the information, like what the hours are, what the intent is, what's the age group. And, obviously, if you have to fill out a forms and you have to state that you're not allergic to something like eggs or some other kind of the base of the, what do you call the vaccine. So so people just don't have an anaphylactic reaction or some other kind of medical condition while they're getting an inoculation. So, but anyway, that's pretty much established because it was set up as a true, let's say command structure, incident command all the way down. So, and we hope to have one for an overflow hospital situation should this thing mutate and, staying on the offense and proactive versus on the defense. Hopefully we'll never need it, but choosing a couple of buildings in town that could be turned into let's say a mobile hospital would be, an advantageous thing, since Milford is probably going to take care of that community first, and anybody else that in the surrounding area uses Milford, which would be all the other towns. We're going to need that situation. So anyway, so we'll pursue that as soon as I get some information from Louise and one other person. Okay, so I guess next item is bills. Professional services for Bruce, I guess.
That's
I don't see that.
That's what do you call it? A bill for my license.
Oh,
Renewal.
okay.
I didn't get a copy of it to sign anything, but I'll make a motion and then I'll just get it from you guys and sign it.
The bill, they've gone to paperless and checks less. It has to be done with a credit card, so I'll put the credit card through and then talk to Mary today about getting reimbursed on it. I know that's not the typical policy, but because of the way the Commonwealth's doing business now, it's the only way that'll work right now.
Bruce, we do have a town credit card, right? That should, since it's professional services, probably the division of licensing.
That's right.
We should be able to ask Mary. We should be able to use that. I think in the past well, at least the former CFO wanted the town credit card used versus a check or your credit card, because then it just becomes, they need the receipt, they need this, they need that.
I mean, I can give them a
Ask
receipt.
her about just using the town one, and we can approve the $150 tonight. So somebody want to make that motion?
You guys
Penny,
approve it, and then I'll work it out with Mary as the.
Good, Dennis, yes.
Yeah, the town credit card, we have credit cards for things like Staples and Home Depot, but there's no general credit card that we
Okay.
So I'll just pay it and submit my statement and get reimbursed that way. As long
Yeah,
as
that'll
you
work.
approve it, then Mary knows it's okay to,
Okay, somebody want to make a motion?
Do we make a motion tonight or wait till we get the receipt? Make the motion now.
I think we do the motion now, then
Okay.
Bruce will pay for it, and then we'll get the town.
Then there's no lapse. Okay, so I'd
Right.
like to make a motion to approve the payment of $150 to Bruce Wilson for professional services.
She seconded, but she's on.
I second that.
Okay, all those in favor say aye. Aye,
Aye.
opposed, abstained, so carried. Okay, so I guess we have a plan for review for 5 to 7 Plain Street.
Yeah.
right, Jim, if you could pull the plan up, please.
Okay,
This is a very difficult lot because of there's a little isolated wetland. If this were a town without a wetland bylaw, that would be something that could be filled. But because the town has a wetland bylaw, the isolated wetland is protected, so that we've got a small window area that we can work with. So I worked with the engineer on this. We decided to go with a Presby system to keep the footprint as small as possible. So we're looking for 3 local upgrade approval waivers. The septic tank and pump chamber would come in under 310 CMR 15405-1B, I believe is. I sent you guys an email later with it, but I didn't e myself with it on the waiver list. So if you look on there, but I believe it's 1B on the setback. The tank and pump chamber are closer to the building than typically allowed, or to the property line. Actually, it's the property line if I'm looking at it here, where we'd be looking for 2 feet from the property line where 10 feet is required. And then the next waiver would be on the distance from the septic system to the slab foundation. 10 feet is required. We were looking for a waiver to reduce it to 5 feet. That is also 1B, 310 CMR 15405-1B. And then the third waiver is the waiver for the distance setback to the wetlands. 50 feet is required, and we're asking for 35. The Presby was chosen because it does offer a level of treatment as well as being able to, get the effluent into the ground. That is 310 CMR 15405-1E.
Okay. Since Bruce has read them all off and stuff like that, I guess that saves us.
Yeah, I've got it all right here. Want me to make the motion?
Yeah, go ahead, Kel.
All right, so I'd like to make a motion to approve the septic plan review for 5-7 Plain Street with 3 local waiver requests. The first being 310 CMR 15.4051B to allow the septic tank and pump chamber to be placed 2 feet from the foundation where 10 feet is required due to limited space. The second being 310 CMR 15.4051B to allow the septic system to be installed 5 feet from a slab foundation where 10 feet is required due to the close proximity from the isolated wetlands. Septic system is designed with the Presby environmental treatment system resulting in a smaller footprint, but space is very limited, so a waiver is needed. And the last one is 310 CMR 15.4051E to allow the septic system to be installed 35 feet from the isolated wetland where 50 foot is required.
Okay, Trish.
Okay. I'll second that.
Okay, all those in favor say aye.
All right.
Aye. Opposed, abstained,
Could
so
you hear me?
carried.
I
Okay.
second that.
Yeah.
Aye.
I have
Yep.
payroll, so I'm just gonna sign these and I'll get it to you guys somehow. When I go deliver t-shirts, I'll drop it off in your
Okay.
mailbox.
Good.
Okay.
Okay, so anything else, folks?
Good and welfare.
Yeah, go ahead.
Originally gonna have Peter from the school superintendent to jump in, but he's meeting with his board to get a little more direction. But we've got the senior class graduating here, so the board, if they would be thinking of ways that we can make that happen over there, and get your comments to me, and I'll be working with Peter to try to come up with a way that they can have their graduation out in the football field without causing too much concern. But
How about instead of cap and gown, we do Tyvek suit and cap?
actually
And mask.
They're
Right.
hard to come by.
I know, it's
There's a
just,
shortage.
Yeah, yeah.
currently working with Peter on a similar plan, but much nicer.
Yeah.
The gowns are black and white. Guys black, the girls will be wearing the white. I'm recommending a white bandana with black stenciling on it that says class of 2020 with the school's emblem. And then as far as gloves, they do make a black latex glove. I've got the guys down at the Trump headquarters. They're going to donate 2 boxes of black gloves on that. So I'm going to be looking for some donations or some, try to get somebody to get us the 150 white bandanas so that we can take that over to the guy that did our t-shirts and see what we can do there. But
So what's
That's
the
what-
purpose of the gloves? Is it to shake?
common
The hand.
services, shake the hands, you receive your diploma. I'd rather see the black gloves with the black and white than our nice little blue latex ones. They kind of don't go
No,
well.
I just didn't understand what would be the purpose of the gloves if they're outside and no one's touching anything. That's all.
But I mean, it's more. I mean, the proverbial handshake from the principal. I mean, they're kind of like a
All
rite
right,
of passage.
so they're still gonna do that. Is the principal gonna hand them their diploma?
Yeah.
Okay. And are they gonna put the gloves on right before they walk down so that they're nice and clean and we know they haven't touched anything? Or how's that gonna work?
I mean, it's going to take a level of
Because we're not gonna give them to them ahead of time, right?
no. They're going to have to do it in groups of. Originally, Peter suggested like 20 people. So as it gets to be their turn, we can hand them the gloves as they go. Some of it's going to be some staging of where the next round of people go. We talked about alphabetical, you know, all the people A through C or something like that, you know, like 20 people at a time, get them through, a lot of things to think out. So, I mean, if you guys have some thought, please, you know, get them back to me so that I can work with Peter and we'll come up with something.
Can you space them out too, like as they're lining up? They should try to do a 6-foot spacing. Maybe you can use a piece of tape or a marker on the grass, whatever.
Yeah.
Yeah, no,
Of course,
we'll do something, yeah.
How many people under the age of 18 have died from this? 0?
No, there are
Well,
some. I don't know the number off the top of my head, but
Right.
It was 2.
2 in Mass.
No, 0 in Mass.
0 in Mass. Okay, fine. Yeah, I guess, you know, I guess the other thing too is no hugging, even though technically you're right, they may have a less of a likelihood, you know. I mean, it still follows, we're trying to follow the governor's order, not by age group, but by the entire population. So no one says, well, he doesn't have to do it, so why should I?
Again, the graduation isn't going to be until like the first or second week in June. So
Okay.
hopefully by then, you know, the stay-at-home order is gone. But, you know, again, we're going to, as the committee said, we're going to have to phase everybody into some sort of normalcy, but still some sort of level of protection. So it's, life as we know it's going to be different going forward, but
Right.
hopefully we can achieve it all safely.
Yeah, I don't think the summer will be as, how do I say, as open as we're normally, you know, seeing it. And certainly, you know, the plan is not to have a rebound before November, you know, when the flu season starts, you know.
But I personally think that, you know, we need to, it's very difficult. The seniors had a pretty crappy hand handed to them. You know, we want to send them off with something that they can remember and look back on in their later years, you know.
Now, are they trying to do a set date though, or are they trying to push it out?
With more information coming. Obviously, Peter's meeting with his board, and we'll have some more information to go. I'm just trying to, you know, make people aware of it and look for suggestions, and they're just starting the planning portion of that, and more information to follow.
Okay.
Okay. Like, any other questions for anybody? Okay.
Where can townspeople find gloves and masks?
I'm sorry?
from the town? Is there anywhere where the townspeople can find masks from the town? If the town's requiring it, I think there should be somewhere where you guys provide them.
Some of these stores are offering them at the door. The managers
It's not
have
the
them.
store's responsibility. You guys
Yeah.
made the rule.
It doesn't have to be a mask. It can be any type of face covering as long as it covers.
I don't
your nose.
have any face covering. I need the town to provide it.
You don't have a
If you're gonna-
scarf, a piece.
If you're going to make a rule, you have to provide it.
It's a piece of material. Doesn't have to be a mask.
Where does it say that?
It just says any type of covering, and it gave an example of a scarf, a mask.
The
It
bandana.
could be anything.
It's
You
in
could
the
take a
actual-
shirt and
And what scientific evidence do you have that a scarf or a piece of cloth is going to actually provide any kind of cover protection?
well, it's definitely going to stop the droplets from spreading.
Right, you can't
What is your
aerosolize.
scientific evidence? What is your proof? What scientific research do you have that proves that? You're just making stuff up. I mean, I can say whatever I want to. Oh, geez, yeah. The air dissolves. It's gone before anything happens. You can't make a rule. You're the Board of Health. How about some scientific backing behind a law that you're making? And it is a law because you are threatening arrest for people who do not comply.
Not sure.
So some sort of scientific research should be provided if you're going to make an edict like that.
I think if you look at what was said from the CDC, from,
The World Health Organization and the CDC both only recommend it for people who are sick, coughing, or sneezing.
right, but I'm saying a bandana
not
or
me.
some kind of face covering
No,
is
they
better
only
than-
recommend masks for medical workers, people who are sick, coughing, or sneezing. I have the website right now up on my phone. So again, you guys are making rules without scientific evidence to back them up. You're providing a false sense of security to the people that you work for. And I think that's wrong. I think you guys should really take a good hard look at what you're doing. You're providing panic. You're providing no real answers, just making rules. Everyone else is loosening their rules. Rentham opened up their parks. The rest of the world is loosening and you're tightening. Something's not right there. Unless
Think
you have
Grantham-
some sort of scientific evidence to prove that you're correct. Until then, I will not comply.
Okay, Timothy. Thank you.
Thank you. Thank you for letting me speak. I do appreciate that very much.
No
Thank you.
problem.
Okay, anything else?
I don't think so. I'd like to make a motion to adjourn.
All right, I second that.
All those in favor say aye. Aye.
Aye.
Opposed, abstained, so carried. We're adjourned.
Good night.
Thank you.